Hi, I'm Dr. Marian Owen with Whole Family Medicine. I'm going to talk today about updates on COVID vaccines and answer some frequently asked questions that I've been getting about them and COVID in general. So, first, I'm going to address reactions to the vaccine. People are concerned still about the acute, like right after getting the vaccine reaction, the very small risk of anaphylaxis. That is a reaction that is monitored for after you get any vaccine, and it doesn't appear that it's any more common with the COVID vaccines than with others. So that's one thing to just as you process whether or not you want to get one. If it's not in your risk calculation when you get your tetanus update, then it probably shouldn't be in your risk calculation here. It's why we keep you after a vaccine for 15 minutes to observe you for any untoward reactions. If you are at high risk, meaning you've had severe allergic reactions in the past or on the other checklists that they ask you to fill out, you have a positive answer, please stick around for 30 minutes in case something comes up. But there really have been almost no severe reactions outside of that 30-minute post-vaccine window. So, and as it stands now, I am not aware that anyone has died from that, and I am watching for that. There are more site reactions after the second vaccine. Even after the first vaccine, it's common to get redness, swelling, achy, very sore for a few days. Even some like localized heat, redness kind of stuff beyond the site itself, pain when you're moving your arm, all of that is normal and expected. After the second vaccine, for many people, that is more pronounced. And there is a fairly large group of people that is having even stronger immune responses after the second vaccine, meaning so in our practice, there's 4 people that work in my office. All of us have gotten our second vaccine. I had very limited reaction, a slightly more intense site reaction, but didn't last as long with the second one, but that was it. I was hiking the next day. The other 3 members of my staff all kind of lost a day to flu-like symptoms, body aches, chills, pretty pronounced for 2, bony achy pain was very pronounced for 1. So those types of reactions are within the realm of normal, and you should expect them. You should not pre-medicate, meaning taking Tylenol or ibuprofen or any pain reliever before getting the vaccine. One, it's not shown whether or not that might impede your immune response, but also the reactions don't tend to hit until 8 to 12 hours later, and so that dose isn't going to help you. If you have symptoms that are bad enough that you want to take a pain reliever or a fever reducer, do so, but wait to have the reaction. Don't pre-medicate them. So then I also have heard from some people who are concerned, well, I didn't have a strong immune response after the second vaccine. Does that mean it didn't work? No, it doesn't mean it didn't work. Not everyone gets a strong immune response. Don't worry about things like that. Try not to worry about so many things. Just get your second vaccine and know that in the group that was vaccinated to approve these vaccines, there was the same range of side effects from none to what we're seeing, and the effectiveness was 94%, which brings me to the second question that I'm getting, like, what does that 94% protection mean? What kind of protection are we getting from these vaccines? So I'm going to talk about that. So when we say a vaccine is 94% effective, that means in this group of people who got the vaccine versus this group of people who didn't, and they are, control matched, similar populations, similar behaviors, 94% fewer people who got vaccinated got sick. So that's what that means. And so that's what it means for you. It doesn't mean like you only have a 6% chance of getting COVID. That it doesn't translate that way. It just means that your protection is much higher. Your risk of getting it is much, much lower. In any given situation, any given level of exposure, you could still get it. It's just much, much less likely. And the good news is, as we are monitoring over time people who have had the vaccine, we are not seeing people who are getting severe disease and dying amongst people who have been vaccinated. So it seems definitely even like more protective against that severe, scary kind of COVID, what we're trying to not get. So it is effective, it is working. So keep getting them when you can. What we don't know, and I don't know when we'll know, we're monitoring and they're doing the testing that they feel they need to do, that the statisticians have told them is appropriate, and I don't do stats, so I don't know. But they are monitoring to see, like, now that I've had my COVID vaccine, can enough of an infection get set up in my system that I could spread it to other people, or does the vaccine keep that from happening? That's not been studied yet. We don't know. So until we know, presume that the answer to that is yes. Presume that you can still be infectious. And in fact, presume you might be one of those super spreaders that it doesn't get sick, doesn't know they're sick, so goes and does something, and now everyone you had dinner with gets COVID. Don't be that person. So even if you've had your vaccine, it doesn't mean you can't spread it. So continue to wear your mask. In fact, with the new variants, which is the next thing I'm going to get to, double masking does seem to be even more effective at these more effectively spreading variants. So now double mask and continue to do the appropriate social distancing, washing your hands, limiting time indoors with people who aren't in your immediate family or pod. All of those things, everything you've been doing, continue to do it, even after you've been vaccinated. Until enough of us are vaccinated, we are trying to cut down on spread. And I'm going to talk about that more because we need to talk about variants, what's happening there. We are hearing reports of new types of COVID emerging in different parts of the world. There's the Great Britain variety, there's the South Africa variety, there's one in Brazil we're watching. What's going on here? Well, what's going on here is evolution. Things that reproduce and use genetic codes to code their information to pass on to the next generation. Mistakes are made as we copy that code over time, and so we get changes in the proteins that are coded by those bits of genetics. So in this case, it's an RNA virus, so it's RNA that's changing over time, and RNA viruses are more prone to that because RNA doesn't have, anyway, I'm not going to go into that, but RNA viruses are more prone to that, and so it's happening, and viruses replicate, meaning copy themselves over and over and over and over again really quickly. So there's many, many, many opportunities for little changes to happen. And sometimes those little changes are inconsequential. They don't change anything about the virus. Sometimes they are deadly to the virus, and the virus can't pass itself on anymore. Like, it doesn't make its little protein coat very well anymore, so you can't make more virus, and so that mutation goes away. But sometimes the mutation makes it better at spreading or a little bit more infectious. And those changes accumulate in an area as that virus is spreading in that area. So anything that gives this version of a virus advantage over this version of a virus is going to make that one spread more in that area and become a dominant strain of the COVID virus. Sorry, I keep saying vaccine instead of virus. A more dominant strain of the virus. And so then that's going to be spreading in that area. And if the change makes it spread more easily, it's going to spread everywhere. And we're already seeing that. You know, we're having some of the UK virus that's spreading very rapidly in communities around the country. And in Georgia, it's very quickly, you know, I think I saw a prediction that, you know, by the end of March, it will be our dominant strain. The good news is that virus isn't more virulent, meaning it doesn't kill you better, it just spreads better. So spreading better means it will infect more people, means that more people could potentially die from it because more people are going to get it than have with the other one. So that just means we need to double down on our work that we're doing to protect ourselves and one another. And that's why the double masking and why you need to continue to do everything that we've been telling you to do. Wash your hands, double mask, stay home when you can. Choose not to go inside with people you don't know. Keep your mask on when you're inside when you can't avoid that. It's why we're trying to keep you out of the office as much as possible and take care of your needs through virtual visits. But again, some things can't be done virtually, so we're having you come in. But, as much as possible, we want to limit those kinds of exposures. So, if you've had the vaccine, you have more protection against these variants than if you haven't. That seems to be clear. How much more? We don't know. But the way we keep these variants from happening and the way we keep them from becoming dominant is to get as many people vaccinated as possible so the virus doesn't have anywhere to spread to become dominant within. So it's even more pressure, even though you're hearing, well, the vaccine might not be as effective. It's still effective in that it will keep you from getting severe infection. It will probably keep you from dying. That's our goal. But it might not keep the virus from spreading. It'll slow it down. And if we slow it down, it doesn't have as much opportunity to mutate and spread some more. So we want to achieve that. So that's my word about the variants. Some people are asking about travel. Oh, I've gotten my vaccine. Can I go do this thing now safely? So it depends on if you're thinking from the individual perspective or from the group perspective, right? So as an individual who's been vaccinated, if you get on an airplane and someone on that airplane has COVID, you are less likely to get severely ill and die from that exposure. That's good news. But you may contract the COVID. We don't know if you will or not, and you may then be able to spread it. And because you're vaccinated and maybe you're acting a little less civic-mindedly about that, you might become a spreader. So from a group perspective, no, you shouldn't change your behavior at all. If you wouldn't travel before you got vaccinated, don't travel after you've been vaccinated. In terms of what do we know about travel and is it safe, there's one little study on people that were flying into New Zealand where they had COVID totally under control, and then they were quarantined in a hotel and monitored everyone on the plane for 2 weeks. And from that one little tiny study, it seems, and one study, take it for what it's worth, it seems that it spreads in aisles better than on window seats, and that it spreads, among local people more than it spreads across the whole plane. But how do you know if the person next to you has it or not? You don't. So it still, to me, feels like if you weren't going to fly before, don't fly now. But you can do things like what I did a few weekends ago. Rent an Airbnb, take your food with you, and go be in that place that is clean, and continue to not interact with people you haven't been interacting with before, and experience a change of venue. And that was wonderful to do. I highly recommend it if you can. And that is very safe. So that's the kind of travel I would say is absolutely safe. Flying, I'm still not super comfortable with, but I wasn't comfortable with it before, so I'm not comfortable with it now. And the last thing I want to talk a little bit about is after COVID. So we're hearing more and more, and of course, the internet likes to feed you things that are alarming. So you're going to see more and more alarming stuff because it'll make you click about post-COVID syndrome. And it is alarming. It's bad that this is happening. So what's going on in people who are COVID long haulers? Well, a lot of things we don't know yet, for sure. What we do know is there's a group of people who doesn't get very ill from COVID, meaning they're very low symptoms, but that fatigue is just carrying on and on and on, or pulmonary things are carrying on and on and on. And that's very disconcerting. But what we know is that a lot of people who are asymptomatic, in fact, have pretty marked changes on their pulmonary CTs, like their lung scans, and there's scarring and there's flattening of the little alveoli. There's all kinds of things that happen when you're sick that might then continue to impact your lung function and your oxygenation after getting better. And so what can you do? Well, one is give yourself the grace to be sick. When you are sick, rest and let your body do what it's supposed to do. I'm not going to list again all of the supplements and nutritional advice that I've given you. That has not changed. If you're watching this video, you can link to my our YouTube channel from it and see my recommendations there again, and do those things. But then after you're getting better, if you're still feeling short of breath, it's not time to get back to running. Allow your body to tell you that it's tired and be tired. Don't return to aggressive exercise too soon. That increases your oxidative stress and it makes your fatigue worse. Your body is still in recovery. There's still a lot of cleanup going on. You don't need to add extra work for your cleanup systems by increasing the strain on your system. I know you feel like a slug. You've been sitting around in bed for a long time, but just continue to give your body time to heal. Another thing that has some pretty good evidence that it helps you heal is to do basically pulmonary therapy, taking deep breaths, 3 deep breaths where you inhale for a count of 4, hold your breath for a period as long as it's comfortable, and exhale very slowly 3-4 times an hour to really expand and ventilate and bring cleaning blood through into those areas of the lung that have gotten collapsed and damaged. So slow, deep breaths that really go all the way down to the bottom of your chest. So and I didn't hold my breath very long. I can go a lot longer than that, but you don't need to watch that. But if you can, hold it, really hold it open so the blood can circulate in there for a minute. Those things seem to be really helpful. I also want to talk a little bit, and you can revisit a video I've done before on the limbic system and its role in perpetuating chronic illness. But one of the things that's uniquely challenging about having gotten infected with COVID is that it's scary. It's new. It's unpredictable. So all of those things get your limbic system, the part of your brain that's the threat evaluator, afraid and on guard and making you much more aware of your symptoms. That's the limbic system's job. And when you are under threat, its job is to evaluate further threats and let you know about them so that you act on it. So the limbic system gets hyper-tuned, hyper-aware of aches and pains, of how am I feeling, am I breathing fast, and then that it's always feeding it up to your consciousness. And your job as a conscious, rational person is to say to your limbic system, I hear you about my thumb aching a little bit. It looks okay and it's moving fine. I'd like you to stop making me worry about that. I'm choosing not to pay attention to that right now. And you can do the same thing with any kind of pain. You can do the same thing with fatigue, with brain fog. The more you focus on it, the worse it becomes because it feeds back into your limbic system, and your limbic system can generate the symptoms. It can amplify them. It can make them worse. And so I think with COVID, because it's scary, it has this added tendency to do that. Any fatiguing illness can do that because we feel so confused by it. If our only symptom is fatigue, it's unsettling. And so with COVID, with that prolonged fatigue, you can overthink it, over-research it, and that itself can amplify your symptoms. Doesn't mean it's all in your head, doesn't mean there isn't something real going on. And I'm watching the information that's coming out, and if there's something we need to be doing to support you through that, we will. But for now, the main thing is give your body time to heal. Trust that your body can heal. You were healthy before, you will be healthy after. And when you are in that healing process, just know that that's what it is. It's a healing process. And expect to get well. Let us know if you have any concerns, if anything's being prolonged, if we need to look into something more. You can get secondary infections after COVID. So let us hear from you if you have any concerns. And there are a few nutritional things that I'm looking at and trying with some people. But to me, the most effective thing so far that we've implemented has been that getting yourself back in charge of your limbic system to allow the resolution of healing, because the limbic system will keep inflammation going when it's worried, because the state of worry is the state of inflammation. So do your best not to hyper research it, because that only amplifies that limbic worry. Trust that Susan and I are following the literature. Let us know what your unique concerns are. Let us help you navigate through the storm of misinformation, slight information that's amplified, things that are on the internet and on your chat groups and places, and let us add science and reason and support to that. So let us do the research. You tell us what's going on, and we will do our best to help you. So that is my February 2021 COVID and related things update. Again, I hope you're well. It is my hope that by July, we will be back to a much more normal world if the promised vaccines get here and if people will get them. We could potentially get to herd immunity in this country by then, and that would be wonderful. So do your part. Continue to not be a spreader. Get your vaccine. Let us know if we can help you in any way. Be well.